Hey guys, thanks for joining me today. Today we're reviewing the proper way to test Thomas test. So this is a test of the hip flexor length. What you need to know about the hip flexors is that there's hip flexors that cross one joint, the hip, and hip flexors that cross two joints, meaning the hip and the knee. So I'm going to take you through the typical way that I test it, what are normative values of proper length test measurements, and if they're appropriate for treatment. So I'm going to use Jeremy here as my model, and we're going to start with him at the end of the table. You kind of get the table at a height where they can lean back, and then you have him grab his one knee, pull it to your chest, and then you assist the patient down on the table. Good. Now, in this position, you want to make sure the sacrum is flat on the table, knee is to the chest. Now, normal hip flexor values for the one joint is flat or 0, and you can see he's probably 5 or 10 degrees from that measurement, so he's lacking 10 degrees there. Now if I hold that down and let's bend the knee as much as you can, and he gets about 80 degrees, which is normal. So, and then you straighten it out for me there. Good. And that leg goes flat as he straightens it, so it lets me know that it's not a two joint muscle that's the problem, it's a one joint muscle. So how I would define that is that he's lacking 10 degrees in his hip flexors. Now, the other scenario would be that he's flat now, okay? And this leg, where we test the lower leg where we test two joint muscle length, if he tries to bend it and it stops right about there. So you can see he's not at 80 degrees, so let's say he's lacking 20 degrees there, and he's at 0, that would be a 20-degree deficit in the two joint hip flexor muscle. Now, you can have both that are short, like in this position, so you would combine the degrees for total hip flexor loss, and that's how you would define if the test is positive when you go to later retest it after you do some techniques. So again, with this one, you can test bilaterally to make sure that things are symmetrical or not, and this can lead you in a direction of, is there a mechanical deficit at the hip, or is there actually a soft tissue restriction at those hip flexors, given the fact that you've accounted for all compensatory movement at the low back, sacrum. So you can make a positive test if you're not meeting your measurements, and then retest after you've done some treatment, and the goal is to get flat here and about 80 degrees of knee flexion there, meaning that both hip flexors are at normative length, and you can rule that out as a possibility of pain. All right, guys, thanks for tuning in.